Okay, good afternoon, everyone, and greetings from Geneva. I'm Tony Consul, the Head of Communications here at IATA. Thank you to everyone for joining us in this press briefing. We have with us Alexandre Juniac, our Director General and Chief Executive Officer. We also have some other IATA executives standing by to help us respond to questions. Today's briefing will be primarily about testing. And a new position that IATA has adopted on testing. So I'll ask Alexandre Juniac, our Director General and Chief Executive Officer, to explain that position before we throw it open to questions. So Alexandre.
Thank you very much. Good afternoon and welcome to everyone. Today I want to talk about COVID-19 testing in the travel process. IATA is calling for the systematic testing of all international travelers before departure. This should enable governments to safely open borders without quarantine. And it will provide passengers with the certainty that they can travel without having to worry about a last-minute change in government rules that could spoil their plans. We did not come to this decision lightly. The integration of systematic testing into the travel process will present logistical challenges and impact how people travel. It needs testing manufacturers to develop tests that can be deployed, that are fast, accurate, scalable, affordable, and easy to operate. We expect a solution or several solutions to come in the market in the coming weeks. And considering the potential scale of the testing required, non-medical personnel will need to be able to operate it effectively. And it will need governments to agree on common standards so that tests administered in the departure country are accepted on arrival. So there is quite a lot of work to do. But if you look at the uptake in travel since the cautious reopening of borders beginning in June, the results have been dismally disappointing. International travel was at just 8% of its year-ago levels in July. There were little signs of improvement in August, so the summer travel season did not deliver any bounce. And it is hard to see a major uptick in corporate travel amid the concerns of a second wave of COVID-19 infections. Quarantine measures are killing the industry's recovery. Some 83% of travelers in a recent 11-market survey said that they will not travel if there is a chance of being quarantined at their destination. That's a very clear signal that this industry will not recover until we find an alternative to quarantine. We believe that alternative is systematic 100% testing of all travelers before departure. And the same public opinion poll tells us that this is what passengers will accept. 84% agreed that testing should be required for all travelers. 88% agreed that they are willing to undergo testing as part of the travel process. That still leaves the challenges that I outlined earlier to be addressed. And here is how I believe we can do that. First of all, cooperation. We will work with the airports and other partners on how to include systematic testing in the travel process. Testing should not be a permanent fixture, so we could be creative with solutions. It's a challenge, but we have done it with a growing footprint of security. And we should not forget that there are many testing programs in place as part of the travel bubble or travel corridor concept that is being pursued bilaterally by some government. These are giving us practical knowledge of what will be needed to do testing on the scale that would be required for a full industry restart. But we firmly believe that it must be done before departure. This seals off the system. In addition to giving governments the confidence to reopen borders, it will also boost passenger confidence knowing that everybody on the aircraft has been tested. And by doing it in the travel process, we are avoiding issues of quality control or fraudulent results. Second point, availability. Testing technology is rapidly developing. Roche and Abbott, for example, have tests that meet most criteria but need medical personnel to administer them. The speed at which testing capabilities are advancing tells us that we will have deployable options in the coming weeks. And by signaling now that this is the industry's preferred option, we are sending a strong message to the market that should accelerate development and earmark aviation as a big customer. Third point, global standards. Testing will only be meaningful if results at departure are accepted on arrival. This is where the leadership of the ICAO card process will bring together governments, the health authorities through WHO, and the industry will be critical. We are proposing that governments agree to testing standards through ICAO. The card process has been efficient so far, with the takeoff guidelines being widely accepted and implemented. We'll be working closely with ICAO and the health authorities to make this next step a success as well. Time is of the essence. Our position today is setting a major marker for everyone in the industry to aim for. Much will need to be done to achieve 100% testing of all travelers prior to departure. We don't see any alternative solution that would be less challenging or more effective. Aviation has a track record of pulling together to meet major challenges. We did it with security after 9/11. We were the first industry to set and achieve global targets on environment, and each and every day we work together to deliver the safest form of long-distance travel. I am confident that by uniting around a common position on testing, we will deliver an effective alternative to quarantine that will be accepted by governments and the health authorities. And in doing so, we will aid in the economic recovery. Aviation supports the 10% of global employment tied to travel and tourism. And we are a key driver of global trade that supports the livelihoods of millions more. I look forward to your question and welcome your question, and we will answer them with several members of IATA team.
Okay.
Thank you for your attention.
Great. Thank you, Alexandre. While we're waiting for the questions to come in via the chat function, I will remind everyone that please, if you could input your questions, we'll get to them in the order that we receive them. In the meantime, perhaps Alexandre, just a question for you to start us off. How quickly do you see progress potentially being made towards implementation of a comprehensive or systematic testing system?
There are as you have understood, several issues to be dealt with. The first of all is the testing industry ready to provide the right test? As I told you in my preliminary remark, the industry will be ready in the coming weeks. We'll be ready in terms of accuracy, rapidity of the test, availability, scalability, affordability. We should have something around the antigen test that should be ready by in October, and then we will need production rates that are compatible with the needs, not only of aviation but of the various parts of the world that are requesting tests. Aviation being probably a key one. Secondly, we need to discuss and convince governments that it is the right process for them to lift the restrictions on borders and on travel, and particularly the quarantine measures. With quarantine, the governments are killing air travel. But we fully understand the need for protection of the population against re-importing the virus. So that's the reason why we are proposing COVID-19 systematic testing for passengers at departure airport as an alternative measure to quarantine. That would, restart or help to restart international traffic. So that's the point, and we hope that we will achieve global standards within ICAO to convince government to adopt a similar homogeneous approach that will be mutually and internationally and broadly recognized and accepted. Otherwise, it cannot work properly.
Okay. So we have a question that asks for some specifics. So is this 100% for all travel, or are we talking just for international travel?
We are talking about international travel, knowing that for the domestic market or for some continental market, there are still solutions that are working, that are existing and working. So we are focusing, first of all, on international travel because mainly the quarantine measures are mainly applicable to international passengers crossing borders. So we think that is the priority.
Okay. Second question is, who pays for the testing?
But that's a very good question. The interesting point with the new antigen test is that we see the cost of testing significantly dropping. It's now below 10 Swiss francs or 10 US dollars a test, around 7 or 8 Swiss franc US dollars a test, which comes to something which is affordable. So we have to see with government how this cost will be financed by governments, knowing that if we implement a testing process, it's a medical regulation that is within the international health regulation issued by WHO and should be normally paid by governments. So that's what we are advocating for.
Okay. And then a further question is, how do we deal then with passengers who don't show up on testing or who are who can't be effectively be detected through testing?
There are 2 or 3 cases there. Either the passenger is as a positive test is infected, he doesn't embark. He doesn't enter into the perimeter of the airport. The airport, and of course, he doesn't embark by definition. Or the test, even if the sensitivity of the tests have significantly increased, they reach something around 97-98% of sensitivity, means that you still have a very small percentage of people that will not be detected. 2%. We think, but that has to be discussed with health authorities, we are discussing that with health authorities, that it is a minimum risk that is compatible with the target of controlling the pandemic in the country without reporting massively the virus. That is the key issue there. We will have to live with the virus for probably some months. And the point is that we have to control the evolution of the virus. Keep that under control. And if we have a 2 or 3% risk of non-detecting people, we think it's compatible with a very strict and very safe and reliable control of the pandemic within the country.
Okay. We have a question about the specific technologies that we're looking at. The questioner asked, can you tell us more about the quick testing technologies you expect to reach the market in the coming weeks? And do you have, I guess, an idea of their availability or scalability in terms of production and getting them into the travel process?
We are not specialists of pharmaceutical diagnosis, but we are in a very, very close contact through our medical advisory council and through our specialists with the big laboratories and the firms that are involved in testing. And what is now clear, and it has been publicly announced by 2 very big laboratories recently, is that the the antigen test should be ready in October to be deployed with a sensitivity which is 97% and above, with a speed that is should provide the result within the framework of 15 minutes, which is at a cost which is around 7 Swiss francs and below $10. With an operation that could be done much more easily because it doesn't request a dedicated machinery or dedicated system to be interpreted, and the production rate are approaching millions per day. So we are approaching the levels that are compatible with the need of aviation, and even of course beyond aviation, with the needs of many sectors that will require testing. We are pretty optimistic that during October and in the coming weeks, we will be able to deploy this testing approach. And the point is now to convince our partners and governments to implement that as an alternative to quarantine. That's the key issue.
Okay. We have our resident expert on testing here, James Wiltshire. Do you have anything to add to that, James?
No, I'll strongly support everything that Alexandre said on the manufacturing side. I think in terms of the conversations with governments, what I'd add to what Alexandre already said about the very high levels of specificity and sensitivity, the accuracy of the tests, systematic testing as well. You're capturing the prevalence rate in the countries, and what we're doing is a lot of modeling with the medical community that shows that in that sense, it's not a 2 or 3% risk of an infected passenger. It's a 0.023 risk of an infected passenger. So you're doing systematic tests with a very accurate testing of a low prevalence population, and your ability to capture people with that is very, very high. So we are very confident that this is a good proposal that will satisfy the needs and the barriers at the bar that is being set by the governments to reduce quarantine and to open borders.
Great, thank you, James. We have a questioner who says, with governments in chaos and disorganized in just trying to meet their own domestic needs for in-community testing related to medical reasons, how can you trust them to be able to prioritize the aviation industry and organize around the scale of testing that we would need for them?
We will do whatever we can, to convince government, first of all, that it is the appropriate quarantine, and then, if, as a logical consequence, if they decide that, they should be with us to consider that aviation is not the only one, but among the key priorities, we deliver the appropriate number of tests, especially if governments understand that air traffic, the restart of international air traffic, is a key enabler for the economic recovery. That is the point, I think, that puts us at the front line of the priorities, because we will help the economic recovery to come back.
Okay. We have a questioner who asks, we've been talking about testing of passengers. The presumption is that this would also apply to aviation workers and crew?
Yeah, we will see how the crew will be, of course, included in the process. They will be included in this process. We have to see at what rhythm, etc. That's typically things we are working on and discussing within ICAO, by the way. It's a part of the subject we are discussing.
Okay. So we have a slightly different question. Someone is referencing some studies that were released over the weekend concerning in-flight transmission. And the questioner says, yes, we see that you've acknowledged these in your medical evidence documentation, but what exactly is the industry doing in order to keep flying safe and avoid in-flight transmission?
The industry is doing a lot of things. First of all, we have implemented what we call the CART 1 measures, takeoff guidelines, which we impose, a multi-layer approach to control passengers when they fly. So it's a combination of health declaration, temperature control, mandatory wear of masks, sometimes temperature control at the arrival airport. So there is a complete process, to avoid a virus transmission on board. Secondly, we are doing a lot to disinfect and clean the aircraft. We have special procedures that have been put in place in April and May to adapt our cleaning and disinfecting procedures using, antiviral products. And we are still, working on with the aircraft manufacturers and with the cabin manufacturers to see how we can even improve not only the design but the materials or the coating of some equipment in the cabin, and to have antivirus coating products. And thirdly, we have done a lot of studies regarding, the ventilation and the air condition in the aircraft, showing that it is based on, a filtering system that is antiviral, that the air is coming from the ceiling to the floor directly and not circulating horizontally in the aircraft, that the air is purified every 3 minutes, which is more than in hospital. So we are working a lot, and we are conducting a lot of surveys to consolidate and to confirm its result based on the experiences and the results that are measured on true real flights. But we are working a lot to confirm that, and the good news is that everything is converging to the same direction. It is safe to fly. The risk to be contaminated on board is very, very, very.
Okay, thank you, Alexandre. We have a question about, actually a follow-up to some of your earlier comments. The assumption is that you're not for PCR testing in airports because they take too long?
We have to find the right compromise between something which is manageable operationally and acceptable from a passenger point of view, and what the testing industry is providing. And so we think that the new antigen test that will be put in the market will provide the right accuracy and the right speed, and are operationally pretty easy to operate. So we think it is the right solution. It can be, if some health authorities are particularly cautious or very, very, very keen to have several testing could be combined with PCR, so we are not against that. But we think that we have to provide a testing solution that has the right characteristic, otherwise it will.
Okay. Recently in the press, there's been some discussion about the testing program in Rome, which recently won some awards. So the questioner asks, is that the model that we're looking at?
Rome?
Yes.
But I'm not sure that it was based on antigen. But at that time, it was not.
Yeah, I don't know. James, do you have any specific?
No, no specifics on that. I'd come back to something that was said in the remarks, though, that there are a large number of these trials going on. We're working with our airline members through the medical advisors group that Alexandre referenced to learn all the lessons from these trials and to incorporate those into the ICAO process going forward, and working with all the stakeholders.
Okay. And then we have a question where, Alexandre, you mentioned that there was little improvement from July to August in terms of passenger numbers. I know we have Brian.
Slide, very little.
Yeah, I know we have Brian Pierce, our chief economist, on the call. Brian, do you have any updated information on August performance? I know we're in advance of our numbers, but
that's right. We have got the data in, and we're going to be releasing that early next week. So I can't give any specifics on the numbers, but I can confirm that Alexandre was right to say that there has been some further improvement, although it's mostly taking place on domestic markets. International, remains very, very slow to improve, and certainly we know from what we're seeing from the more up-to-date flight data that there has been a leveling off in the face of the spikes up in COVID that we've seen.
Okay, thank you, Brian. We have a question about how this proposal might play out in Latin America. So the questioner asks, have we had discussions about this with the Latin American industry? And particularly in, for example, Brazil, where we see the country trying to open up, perhaps other countries might not accept passengers from Brazil. So the question is, how do you see this playing out in Latin America and acceptance amongst governments of common standards?
We do not see Latin America having a different approach or a different concern than other parts of the world. We see governments highly concerned with reimporting COVID-19 in their countries everywhere. And so we will approach Latin America as we approach the rest of the world by convincing them that having a systematic testing, COVID-19 testing approach for passengers at the departure airport is the right way of getting rid of quarantine measures. But we do not see a significant difference between Latin America and the rest of the world, frankly. It is very similar.
Okay. We've recently heard of a lot of efforts to try and reopen transatlantic markets, particularly UK-US or Europe-US. Any predictions on when that market might reopen, and how do you see the testing proposal perhaps playing into that scenario?
The testing proposal should play a key role in reopening that market. Between the US and the UK. If you remember, even a few weeks ago, some US and European airlines called for a testing to reopen transatlantic routes. So we are precisely and exactly in the appropriate area of implementation for that for this new process. Perfectly. But not only, it is applicable everywhere. That's, I think, the strength and the interest of our proposal. It's applicable everywhere, homogeneously, and understood by everybody, accepted by a vast majority of passengers. So we are pretty optimistic that it will work, and it is safe, basically, which is key.
Okay, we have a questioner who reminds us that on September 1st, we talked about testing as being a potential way of opening up markets, and we've talked about that before. So the questioner says, what's different between what we said on September 1st and what we're saying today?
The difference is that we have a practical and a practical proposal to implement. And the testing industry has moved forward and is able to provide, the appropriate, testing product at the right level of production, meeting the criteria we have put forward. So that's the main thing that has evolved. We have seen also some governments progressively evolving in the direction of reopening their borders, provided we are able to give them the right solutions to lift the travel restrictions. So there is a movement towards reopening the borders, provided we have a safe system to avoid reimporting or transmitting COVID-19 between countries.
Previously, we discussed the cost of the tests in terms of the cost reducing, but we have several questions asking who should actually pay for that? Is it the passenger, the airport, the airline, the government?
As I said, normally as it is said in the International Health Regulation that has been issued by WHO, it's a medical measure that should be paid by governments. So we say government should pay for that.
Okay.
But we are pretty conscious that it will be discussed.
Okay. We have a question saying, have we already discussed this with governments, and if so, what was the reception we received?
The answer is yes. We are discussing within ICAO, because in ICAO, as you know, it's the organization that groups governments. It's an agency that groups governments in which we participate. So we discuss that on a multilateral basis, first of all. But we are also discussing that bilaterally with a certain number of states with whom we have some contacts to discuss and test the accuracy of our proposal, and we discuss the potential implementation of our solution. So we are either discussing bilaterally or multilaterally this solution.
Okay. We have a question about reinforcement, or enforcement, I should say, of this. The questioner says, if a passenger refuses to be tested, does that mean they would be denied travel?
If the system is mandatory, the answer is yes. Normally. It will depend on on each government when they will implement the system, but normally if it's there, it's designed for that.
Okay. We have a further precision. So the questioner is saying, is the suggestion that testing would be done outside the airport or on the airport premises?
But that's a point that we are discussing with our airport partners, because it's mainly a logistical problem, by the way. And there are several solutions. It depends probably on some airports. What we are advocating for is to see with the airport if we are able to implement temporary solutions with temporary buildings or tents or whatever to welcome this testing process. We know that anyway it will have to be temporary. It will not last forever, especially if the pandemic disappears.
Okay. So we have another question that's asking for a few more specifics. They note that ACI previously has indicated some difficulties with providing social distancing on board in airports, I should say. So their question is, how would we manage queue and distancing if we're bringing all these people into the airport environment? And secondly, is ACI in support of this proposal?
It's typically something we are working with ACI. We work with the airport on this systematic testing for passengers before departure, and logistically we have to do something together, to be able to find the right how could I say the right way of managing the system and keeping social distancing, and safety at every step. But I'm not very worried. We will find solutions.
Okay. So previously we said, Alexandre, you said that the economic impact of restarting aviation should put us at the top of the priority list for tests. The questioner asks, if we're competing with hospitals and schools for these tests, should we be before them or behind them in the queue?
So each government will determine, which sector they will put forward. That's a decision that doesn't belong to us. We think that we are among the priorities. Number one, I'm not sure.
Okay. And just a clarification in terms of time, we're proposing that 15 minutes should be the maximum for tests to take, or Is there a difference?
We listen to the industry, and they tell us that they will provide tests that give the results in 15 minutes. We think that 15 minutes is a very efficient delay that is compatible with our operations. So it's a pure efficiency logistical approach that drives us there, and of course compatible with a high level of sensitivity, of course.
And if it's right, so I'd also that passengers would be willing to accept that length of time being added to the journey in order to have the confidence.
Correct. And I think we can also say that passengers seem to feel confident with arriving at the airport a bit in advance to accommodate testing. In our public opinion research, we saw that over 80% of passengers were willing to arrive early for testing. We have a question going a bit further on our discussions with governments. Are we planning any pilots, and have any governments agreed to potentially help us in piloting this proposal?
If governments are ready to run pilot tests, we are more than happy. Of course. The more we learn in this type of process, you learn by experience. So the more experience we have, the better.
Okay. We have a question about the type of testing. The questioner says, we've heard previously that antigen tests are more useful for those who have previously been infected, and rather than those who are actively infected or currently infected. Is that a correct assumption? And will these new tests that we believe are coming into the market address that? James?
Thanks, Tony. I think the questioner might be getting confused with antibody tests, which detect whether you've previously had the infection. And we don't think that they are appropriate for a screening test such as what we're proposing. The antigen test does detect presence of active virus. So people who are actively infected.
Okay. Maybe, James, maybe it would be helpful to give us the sort of 30-second, what's a PCR, what's an antigen, and what's an antibody test?
Yeah, very quickly in three ways. I guess you could say there are three types of testing. There's diagnostic testing, which is what you'd use in a clinical medical setting, and that's really where the PCR plays its best role. The PCR is very slow, it's very time-consuming, and very invasive, and very expensive, and not appropriate for mass use in a travel setting. What we're talking about here is a screening test, systematic screening of large numbers of a population, in this case the traveling population, and that's where rapid tests such as antigen tests really have their role, because they can operate at that scale, but with high levels of accuracy. And then when we move post-infection to the, if you like, potentially the immunity stage, and there's a lot of the jury's still out on the science of immunity, that's where something like the antibody testing could, at some point in the future, potentially be relevant. What we're talking about is large volume screening, and that's where a rapid test is most appropriate.
Okay, thanks, James. We have a very practical question, basically saying, what are the practical next steps in pushing this proposal forward?
Well, the practical next step is to successfully convince, the governments within ICAO to adopt recommendations to implement this testing, and at the same time lifting quarantine measures as a counterpart. And we are discussing bilaterally with some government, and we will include some airports and some airlines to try to make test case and in various countries, areas, or between countries to start the process. So practically, that's what we are doing.
Okay. We have a questioner who says the assumption is that the airlines have agreed to this process. We see various airlines doing their own testing programs or testing pilots. So the question is, to what degree of support is there amongst our membership?
100%.
We have full support of our members.
Okay. Sorry, just scrolling through. Lots of questions have come in rather quickly. So, Alexandre, you spoke about the CART process and ICAO. Do you anticipate that this will become a standard that is promulgated by CART, or will this lead to another process to get this type of proposal implemented globally?
We strongly anticipate that it will become the standard. It is not a rule that will be applicable because ICAO has not the power to do that. It will be a recommendation of a standard that will be implemented by governments, and so applicable when governments will decide to implement this standard. Okay. Yes, it will be a standard, but the implementation depends on the sovereign decision of each government.
Okay. We have a question, a slightly different track. The questioner asks, is there any sign of real recovery in the industry? And how does the current performance align with our expectations when we made forecasts earlier this year? So, Brian, that's one for you.
Can you quickly repeat that, Tony?
Sure. So the questioner asks, is there any sign of recovery in the industry? And how does what we're seeing today align with the forecast that we made earlier in the year?
Yes, I think when we're looking at international travel, unfortunately, the situation has not developed, has not improved in the way that we had hoped it would have, which is partly a result of the development of the virus. It's been partly a result of how governments have relaxed, which is how governments have reacted to this, which is the reason for the proposals today. I think we could point to domestic travel, which, where the virus has been brought under control, has risen quite strongly. There clearly is a willingness of people to fly should conditions allow.
Okay. So we have a question. Questioner asks, how is there a risk that countries may implement this system and still maintain quarantine, particularly because you have other modes of transportation that wouldn't be included, for example, shipping or people going transborder in their cars?
There is always a risk of people taking contradictory measures. What we urge government is to replace quarantine measures by a testing process, because quarantine measures are a blocking point for air travel, complete blocking point. And because we think that air travel is absolutely key if you want to have a quick and strong economic recovery, and because it's also a freedom that people, individuals, and citizens, passengers alike, we think that government should do whatever they can to help the air travel to restart. And so they should leave the quarantine measures and the travel restrictions, and we propose the testing system as an alternative. So accumulating the testing system plus the quarantine, it's just, I don't see the purpose of all of that.
Yeah. So, for example, if Switzerland were to require testing for arrival from Germany by air, so you could deal with that through this system, but how would you deal with the road traffic? You would say you would create aviation as an exception or as a separate system to be managed differently than road traffic?
But it will be as usual, air travel will be the safest way of traveling as usual. And we'll be proud of that. And it will be the responsibility of government to determine what they want to do with trains or with road transportation.
Okay. So maybe this is a question for Brian. The questioner says, recently we've seen a lot of airlines announcing cutbacks in anticipated fourth quarter capacity. Is that part of, is what we've been seeing in the last few days part of a wider trend? And does that mean, or is that a further indication that the recovery has stalled?
Yes, I think it is. We've certainly seen airlines announcing that they're not planning to bring back the capacity and the services that they were hoping to do so. The reason being that particularly on international markets, we've not seen either the travel restrictions coming down or passengers returning. So yes, clearly, I think we are in for a much weaker fourth quarter than we were expecting, and that's a challenge. That's going to be a challenge for airlines because that is not typically a strong quarter for cash flows. So yes, difficult times ahead.
Okay. So we have another question asking if there are age limits on what we're proposing. In other words, would testing apply to children as well?
That's a very good question. Typically, to be discussed within the ICAO with the contribution and of health authorities. That's typically something on which we need the contribution and the input of health authorities, and we will follow their recommendation on that.
Okay. We have a challenge on the comment that governments might pay for such a testing program. And the questioner basically says, why should the general taxpayer, who's not necessarily flying, subsidize citizens who choose to fly by paying for the testing?
It's an interesting remark that could lead me to ask people who are not sick if they are ready to pay for those who are, which is called solidarity. So I think it's not totally unthinkable to base a system on asking everybody to pay to avoid the appearance of a risk that could touch them, each of them. It's not totally crazy.
Yeah, so I suppose there's that wider societal benefit that would come from this. Okay.
It's true for many solidarity measures based on taxpayers.
Okay. We have a question about insurance, and the questioner asks, is IATA working with insurers at all to ensure that travelers can have appropriate coverage for their families while on holiday, both in terms of medical cover while abroad, but also in terms of disruptions that may occur as a result of COVID measures?
I'll take that one. Yes, we are working extensively with the insurance community to ensure that those products are available. And we're very optimistic, and we've seen a lot of such products coming to market, which wasn't the case 3 or 6 months ago, but now we're very confident that commercial products are available.
Okay. We have a question about the volume of testing that would be required. Do we have any estimates as to what we would need and when, or at what stage?
That would be available for air travel or generally?
For air travel. In a normal period of time, we transport, 10 million passengers a day. These days, as you have noticed, then we transport no more than less than 1 million a day, probably. So at the beginning, if we had available 1 million tests a day, that would be enough. But if we expect a ramp up in the air traffic, we should have something around 4 to 5 million tests a day that would cover already a significant proportion of what we need. Okay.
But the order of magnitude is millions a day.
Okay.
In normal times, or let's say more normal time.
Right. Okay. We have another sort of practical question. So we've not said specifically on airport and have said before departure. What would be the maximum before departure that the test could be done?
You know, that's a question that is more for the medical community. I can answer with my very little knowledge. We understand that more than 2 or 3 days before departure, you know, is leaving too much room for the risk of being reinfected, to be blunt. So planning more than 2 days in advance or 2 days in advance for testing is too much, and it's with PCR test.
I think ideally in this proposal, we're trying to get it as close to the time of departure as possible.
Yeah.
We have a question about short trips. If someone was going away for a weekend, leaving on a Friday, coming back on a Sunday, would this imply 2 tests, or is there some sort of carve out for such quick journeys?
Normally it's 2 tests. If we advocate in favor of being tested at the departure airport, it is 2 tests. Otherwise, the system is not reliable enough.
I think there's something here about consistency of the process as well. That what's really attractive about this proposal is it's very consistent and simple. What we're seeing right now and what many of the airlines are facing is a real mix of different requirements, 40 or 50 different systems operating simultaneously, and that creates real operational complexity for the airlines. It creates confusion for passengers. This proposal for systematic testing is very clear.
You know, it must be simple without too many exceptions, too many special cases. Otherwise, it will be unmanageable.
Okay. We have a question about the current second wave that's being experienced in Europe. And the questioner asks, is part of this proposal instigated by what we're seeing in the second wave, or has this been something that's been thought up long before?
The answer is no. This proposal is mainly triggered by the situation in which we are, that has been worsened by the new infections, by the way, which is to see travel restrictions and particularly quarantine set up everywhere in a completely disorderly, unplanned manner. And that is blocking completely the restart of travel.
Okay. Questioner asks, if this system is rolled out, do you think it could be done in time to save the winter season for airlines?
We hope. We hope it could be. It is ambitious, but it could save partly the winter season.
Okay, we have time for just a couple of more questions. So the questioner asks, okay. Yeah, so one questioner asks, can we test potentially thousands of passengers a day without risking congestion and contagion within the airport environment?
Of course, it's a risk. Huh? We have to be organized to avoid this type of situation. That is typically what we are discussing and working very, very hard and with the airports particularly.
Okay.
We had the same issue with security. Huh? We managed that successfully.
And then I guess the last question is, what do you think the risk that this system could be sticky and we could maybe stay beyond what is necessary for the COVID crisis?
That's the reason why, from the beginning, we say that this system must be temporary and must be linked with the evolution of the pandemic. If the pandemic stops, there is no reason to maintain that system. It has to be dismantled. And so that is also why we are advocating in favor of temporary installations, buildings, or systems, and not permanent.
Okay. I think that's all the time we have. I have 3 o'clock sharp here in Geneva. So I'll thank everybody for their participation.